Hello, everyone. My name is Britana Guidry. I'm a student at TPI and I am currently enrolled in the RN program. A professional goal of mine, I would like to one day build and open up a long-term care skilled nursing facility. I did a short autobiographical memoir based off the compelling speech related to my late grandmother that passed away in June of 2021. She passed away on June 12th, 2021. She was 88 years old, and her birthday would have been on June the 19th. She would have been 89 years old. I decided to do this story because my grandmother, we were very close. She raised me from the ages of 8 years old until I was 18. We did everything together. We took care of each other. She volunteered at the council agency where there were elderly patients that would go there. They would play games. She would help them. She played games with them. They cooked and, ate food, and it was right down the street from her home. My grandmother was very lively. She would do anything to help anyone. She would always go to church every Sunday. She was a Christian woman. She was almost like my second mother. So it was very devastating for me whenever she passed away. The name of my story and short autobiographical is called Advocating in Nursing. I chose to do advocating in nursing because she was at a skilled nursing facility where she was only supposed to be there for less than 90 days. She had multiple falls while she was at home. So the last time she did have a fall, she fractured her left femur. She ended up going to a rehab facility where she was receiving therapy, but she wasn't progressing. So her doctor wanted her to go to a skilled nursing facility where she would be able to receive aggressive therapy. I chose the facility. Me and my mom agreed, and she asked for my opinion. And she ended up going to a nursing facility where I worked at as my first nursing job. I recommended her going there because I knew most of the nurses, I knew the director of nursing of the facility, and also I knew everyone in the therapy department, and I knew they were really good. So I knew she would get very good care and she would get amazing therapy, so she was able to come home with assistance and with some kind more of an independence for her. But unfortunately, it didn't end up the way we wanted it to end up. She ended up passing away at least 2 months after she was at the nursing facility. She ended up with a bed sore that was not documented, it wasn't treated, and she ended up septic and she eventually passed away. So it's called advocating in nursing. Do you know the real meaning of advocating? It means preserving human dignity, promoting patient equality, and providing freedom from suffering. Advocating in nursing for those who aren't able to speak for themselves. Advocating for those who are afraid to say anything. Advocating for those who want to speak up but can't use the right words. Advocating in nursing, as nurses, this is what we are supposed to do. As nurses, whether you're working in a long-term care facility, hospitals, doctor's office, in homes or at home, in schools, you are still an advocate. You are the voice for your patient. Nurses, always remember you are the voice for your patient because you are the one that sees the patient every day on a daily basis throughout the day. You're the voice for your patient or patients, but to have patience because you are the one that takes care of them, listens to them, feeds them, dresses them, bathes them, comforts them, medicates them when they're in pain or sick. We are advocates for our patients. In this profession, we need to be able to argue without being argumentative. Whether you are communicating with a doctor or nurse practitioner in regards to a patient's health, whether you're fundraising for a nonprofit organization, pitching a business proposal, or suggesting a change to company policy, you are making arguments. As a nurse, you are inclined to care, to be compassionate, to help others. It's simply part of your nature. You feel good about it and you genuinely want to take care of your loved ones and everyone around you. In fact, this is why you became a nurse. My grandmother was a patient at a skilled nursing facility. She had nurses that cared for her, but they didn't really care for her. Yes, they gave her meals and medications. They may have changed her briefs when soiled, but they didn't advocate for her. They didn't voice to the attending doctor and say, "Doctor, something is going on with Mrs. Williams. She isn't doing great today. She hasn't eaten anything today. Matter of fact, she hasn't eaten anything in a few days." They didn't say, "Doctor, she has an area on her lower back that wasn't there when she came in. It has a foul, distinct odor that I've never witnessed before. Can you take a look at it when you do your rounds, please?" Nothing was said to the doctor until Mrs. Williams was unresponsive late one morning and was in respiratory distress, for example, shortness of breath and decreased O2 saturation. Then that's when they couldn't just call the doctor. They had to call 911 emergency, where Mrs. Williams ended up in the hospital on a ventilator. Unable to breathe on her own, a tube down her throat, helping her to breathe at 88 years old. Can you imagine your patient or your family member in this position, with unable to breathe on their own with a tube down their throat? Everyone needs to make sure that they're doing a full assessment on their patients. Make sure that you know your patients in and out, because if the assessments were done on my grandmother, this wouldn't have happened. Her daughter had visit one day and asked the nurse and CNA what was that distinct odor, and the nurse replied, "Oh, that's her bed sore." "What bed sore? She doesn't have any." "Yes, ma'am, on her lower back. We noticed it when we did her assessment when she came in this morning. We will call our wound care doctor to take a look at it and see what she wants us to do," said the nurse. When the wound care doctor came to evaluate the area on Mrs. Williams' lower back, she ordered to do a surgery called a debridement. The surgery was done, which was that they opened up the wound to see how big it was and see what the damage was caused to, and cleaned out the area inside of the wound so it can start the healing cycle. Well, it wasn't any good news that any family or patient would want to hear. After the surgery was complete, the doctor stated in a calm tone of voice, "The surgery went well, and we were able to figure out why she became unresponsive. Her wound was the size of 3 grapefruits, and she became septic, meaning that she has had a bad infection from her wound that went into her bloodstream and has damaged some of her organs." In disbelief, my mother was confused and unable to comprehend anything the doctor was saying to her. They didn't have any documentation from the nursing home that my grandmother had any skin issues. Nothing was documented. It's basically like she didn't have anything wrong with her skin. So for the hospital to find it whenever she arrived on a ventilator, that means something wasn't done right at the nursing home. Unfortunately, after 1 month of being in a hospital setting, receiving IV antibiotics and fluids, and 1 month of being cared for at a specialty hospital where they care for her wound, unfortunately the wound had worsened, and it was nothing more that they can do for my grandmother. They tried a wound vac, they tried a second debridement, and unfortunately it didn't heal because it was so big and she wasn't getting the nutritional status that she needed. So she didn't survive. She went home on hospice a week after she was discharged from the hospital. She died a week after she was home. This could have been prevented if the nurses would have cared for her better and advocated for her. Someone that couldn't speak for herself at one point and needed her nurses to advocate for her. My grandmother went in with limited assistance with walking and her ADLs, and she came home from the hospital. Prior to that, she was at the nursing home, but she ended up total care, unable to feed herself. She had edema, which is fluid in her upper and lower extremities. She wasn't able to feed herself. She was receiving the IV antibiotics and IV medications for her kidneys. So eventually when she went home, she passed away because her body couldn't survive without the IV antibiotics because of the infection of her being septic. It went into her bloodstream. So what would you do as an advocate in nursing? What would you do if your patient or patients are unable to speak, is blind in one or both eyes, is hard of hearing, or can't hear at all? What would you do to make your patient or patients feel safe or comfortable, having no worries at all because they know they have a nurse that's an advocate in nursing? What would you do if the tables were turned and you were the patient? You would want your nurse as a nurse to advocate in nursing. All nurses should come together and make sure that all of us as healthcare workers are advocating for our patients. I have always advocated for my patients, whether I'm a CNA, LPN, RN, nurse practitioner, physical therapist, because I would never want any patient or family going through the pain and suffering that my family did, and especially my grandmother. So start now. Let's advocate for our patients together. Whenever you become a nurse, just please make sure that you advocate for your patients. Make sure you're doing full assessments on your patients, that you know your patients in and out. You're doing body audits. You're putting everything to the doctor. So you are not putting any other family member or yourself through the issues and the devastation that our family went through. Trust me, it's very hard. Still to this day, it's going to be a year in June. And I am still dealing with the fact that my grandmother is not here. Like I said, she was like my second mom. We were very close. So you guys just please make sure that you are advocating for your patients. If you feel something is wrong, even if it's something minor, please let the doctor know, do your assessments, just be a great nurse, because my grandmother did not deserve what she deserved whenever she was in the nursing home. Although she wasn't there long term, she was only there for therapy. It didn't turn out the way that we wanted it to turn out. So just please make sure that you guys are advocating for your patient. I want to thank everyone for listening. I hope you guys have questions, and I hope I'm able to answer them the best that I could. I just want to thank my mom for everything, believing in me. I am an LPN now. I'll be 5 years, so I'm super excited to get my RN. I'm doing this for my grandmother, and I want to make sure that I'm able to build this skilled nursing facility in a few years. I know that you cannot prevent any bad nurses or whatnot to, work at your facility, but just please make sure that you guys are advocating for your patients. Thank you.